Chronic pain, defined as pain lasting more than 3 months, is more than just a physical sensation. It deeply affects quality of life, making everyday activities and even work challenging for millions worldwide. Unlike acute pain, which serves as a warning signal, chronic pain often persists despite treatment and can lead to emotional and psychological distress. Many patients with chronic pain also experience depression, anxiety, and even addiction, highlighting the complex interplay between the body and mind. To truly manage chronic pain, it's essential to understand not just where it hurts, but how the brain processes and modulates pain over time. Pain is not just a simple nerve signal. According to the International Association for the Study of Pain, pain is an unpleasant sensory and emotional experience. This means our brains integrate physical signals with emotions and consciousness, making pain a deeply personal experience. Chronic pain can lead to changes in brain structure and chemistry, especially in areas involved in emotion and motivation. These changes can make pain harder to treat and can even increase the risk of depression and drug dependence. Understanding these brain mechanisms is crucial for developing better treatments. The heart of pain processing lies the mesolimbic dopaminergic system, a neural circuit that delivers dopamine from the ventral tegmental area, VTA, to key brain regions like the nucleus accumbens, prefrontal cortex, anterior cingulate cortex, and amygdala. This system is responsible for executive, affective, and motivational functions. In chronic pain patients, dopamine production and delivery in this system are often reduced, and the structures themselves may shrink. These changes are linked not only to persistent pain, but also to mood disorders and addiction. Dopamine is a vital neurotransmitter in the brain, influencing movement, motivation, mood, and even how we perceive pain. It is produced in the brain through a complex biochemical process and acts on 5 different types of receptors. Among these, the D2 receptor is most closely linked to chronic pain. When dopamine signaling is disrupted, as seen in chronic pain, it can affect not only pain perception but also mood and motivation. This disruption helps explain why chronic pain often coexists with depression and addiction. The brain contains several dopamine pathways, but 4 are especially important: mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibular. The mesolimbic pathway in particular connects the VTA with regions involved in reward, motivation, and emotion. Dysfunction in this pathway is linked to depression, addiction, and chronic pain. Studies using brain imaging have shown that both the structure and function of these pathways are altered in chronic pain patients, further supporting the connection between dopamine and persistent pain. Several brain regions within the mesolimbic system play unique roles in pain perception. The ventral tegmental area, VTA, is crucial for reward and motivation, and its activity is often reduced in chronic pain. The nucleus accumbens NAC is involved in motivation and emotional aspects of pain, and its volume decreases in chronic pain patients. The prefrontal cortex, PFC, helps with decision-making and emotion regulation, but becomes thinner in those with chronic pain. The anterior cingulate cortex, ACC, and amygdala are also affected, influencing emotion, motivation, and pain-related behaviors. Chronic pain leads to measurable changes in the brain. Imaging studies reveal that the volumes of the nucleus accumbens, prefrontal cortex, anterior cingulate cortex, and amygdala are reduced in chronic pain patients. While VTA activity decreases, the other regions often show increased activity, possibly as a compensatory mechanism. These changes not only affect pain perception but also contribute to emotional and motivational disturbances, making chronic pain a truly multidimensional problem. Given the role of dopamine in pain, researchers have explored using dopaminergic drugs to treat chronic pain. These drugs aim to boost dopamine levels or mimic its action in the brain. Studies show that dopaminergic drugs can help control pain in conditions like Parkinson's disease, restless leg syndrome, fibromyalgia, and chronic back pain. For example, medications like levodopa and Pramoxil have been shown to raise pain thresholds and reduce pain scores. However, more research is needed to confirm their effectiveness and determine the best candidates for this therapy. While current studies suggest that dopaminergic drugs may help reduce chronic pain, the evidence is still limited. Larger, well-controlled clinical trials are needed to fully understand their benefits and risks. As research continues, a better understanding of the mesolimbic system and dopamine's role in pain could lead to more effective, targeted treatments. For now, recognizing the brain's role in chronic pain opens new possibilities for therapy and offers hope to those living with persistent pain.